All right. Well, welcome everybody to this Facebook Live. I'm Lynn Schulte. I'm the founder of the Institute for Birth Healing, and I have Justine Calderwood with us. Justine is a physical therapist down in Colorado Springs, or well, Woodland Park, which is just outside of Colorado Springs, right? Did I say that
Yeah,
correctly?
Woodland Park. Yep, it's just
Woodland Park.
of Colorado Springs, and I also practice in Colorado Springs.
Oh, awesome. That's right. You do two places. And Healing
Yeah.
Spot Physical Therapy is the name of your business, correct?
Yes.
Awesome. Okay, so Justine just got certified as a birth healing specialist. So the first one down in the Colorado Springs area. And Justine, congratulations.
Thank you. It feels really good
Yeah,
to be coursework and all the requirements. Yeah.
yeah. And you have such a special skill. I loved having you a part of that whole first group going through that advanced training. And I'm just curious, what have you gotten out of it? What do you feel has been the best benefit maybe of taking these courses and becoming certified as a birth healing specialist?
Definitely has given me a lot more confidence in working, for one, with pregnant moms. I had treated a few before I became certified or before I took your courses, Lynn, but I didn't really, have the skills. I didn't feel confident in it. So definitely the confidence in the pregnancy, but also the postpartum, and really getting the early postpartum and just the effects that being pregnant and birth trauma has on the body. So kind of getting that piece and having the tools to be able to help moms through that. And then also the energy piece, like you teach in that's been huge for me. It's just such a fun piece of being able to treat people that a lot of courses don't recognize that or teach it. And coming into your courses, I had some of that. I am a Reiki practitioner and also do myofascial release. And so I had some of that energy component to it already, but you just took it another step. And I think it's fun and it's really beneficial for the people that I treat.
Yeah, I know. I find it so fun too. What what would you say is one of your most favorite techniques, or if you even can narrow it down to one, what are some of your favorite?
So one thing that I did, that I had learned with you was the visceral manipulation and releasing the organs and the importance of doing that. And really how when we start there, that can really help a lot of the muscular tension and what moms are feeling in other places, even say down into the pelvic floor when we start releasing the kidneys and the liver and the stomach. And that was a big piece that I did not have. And that's been, just been great because not only with the tension piece and being able to kind of release some of that what the body's holding on to from pregnancy, but also helping the respiratory diaphragm come back and being able to work on that breathing piece. So I would say the organ release has been, yeah, very, very beneficial.
Yeah, and I teach it very differently than regular visceral manipulation. So I just want to throw
Okay.
that out there that it's we are affecting the organs, but it's taught in a slightly different way than what you would learn in a regular visceral manipulation course. So I just want
Okay.
to throw that out. If people have taken visceral manipulation, you think, oh, you don't really need that. Just know that the way I teach it is a little bit different. I think easier because for me, my truth is it should be simple and easy.
It is.
and
Yeah.
and some of those techniques in visceral are just a little clunky and complicated for me, and I didn't like them, and so I figured out a new way to do it and still get the effect, right?
Yeah, it is very simple. And when I say like I'm working more with the pregnant and postpartum moms, but I've been even people that haven't been through childbirth, even with my male clients that have just this fight or flight or freeze response kind of stuck in them because of previous traumas or injuries. I'm using those techniques that you taught me and really helping people shift things pretty quickly, actually, in a short amount of time and very significantly.
Yeah, it's so fun. I love what's your favorite part of the whole technique and what you're feeling in the body?
Yeah, just Oh, it's hard to describe that kind of swirly movement underneath my hands. But then as I connect in with my patient and say, well, what are you feeling right now, if anything? And the stuff that is coming to them, like it might be, they're like, oh, I haven't thought about this in years, or they're not able to maybe describe some of what they are feeling, but they just know there's something changing. And when I'm able to check back in with them and say, they might send me a text or an email later and say, oh my gosh, I can't believe how well I feel. Or even that next session when I see them and they say, oh my gosh, this, and this happened from the last time. And it's just so fun.
I know, I know.
Is like following the body when I'm feeling that. But let's say I'm releasing the kidney. I had a new mom come to me for breastfeeding issues actually, and I really felt like she was 5 days postpartum, and I felt like a lot of it was the birth trauma as we talked about her the birth experience, and I just connected in with the organs, and then it led me. I ended up doing, you teach like a release for the pituitary, hypothalamus, and the adrenals. And as I was doing that, she told me, this is going to sound weird, but I'm feeling it right in between my eyes, which is where the pituitary gland is. And I was like, that doesn't sound weird at all to me. So her body told, she was paying attention, and her body told both of us what she needed. And so I went there next, and then, it just kind of it leads from one spot to another. And it really, when you're listening, it takes the guesswork out of that, and, on where to go next, a lot of times.
Yeah, I love that piece. And, as therapists, you're a physical therapist, I hope we mentioned that.
Yeah.
And I think we learn to apply to the body, that that's what we're doing. And this body of work is really about listening to the body and letting the body guide us
Yes.
in the work. And I find it is so much more effective and so much more fun too.
Oh, yes.
Yeah. So do you have, and I'm putting you on the spot here, Justine, so if you can't think of anything, we'll move on. But do you
Okay.
have you just talked about that one case study of your mom, but do you have any other fun ones that you've experienced?
Yeah, another fun one I shared in one of your groups earlier this week. A mom that actually, her son is, I think, 60. So she's up there, and she came to me for knee pain actually. And she had seen, several different practitioners, and she was recommended from a physical therapist that knows me. And she said, you need to see Justine. So she came in, and I said, I know and I evaluated doing all my PT stuff. And I said, I know your knee is doing this, this, and this. I'm going to start at your pelvis. So I connected in, and we started at her pelvis. And I felt actually all of the things that you check in mobility, and she had this open birthing pattern. And I said, okay, I'm going to start at your pelvis. Tell me a little bit about your son's birth. And she goes, oh my gosh, that's been so long ago. But she goes, I actually don't remember. They put me out. So she doesn't have any recollection. She has no idea what happened to her body, what went on. So anyway, that's where I spent the majority of our treatment that day. I treated her knee a little bit because I didn't want to, her to feel like I was addressing the issue she came to me for. But she sent me an email, just a couple days later, and she said, that was amazing. That helped my knee, and I'm looking forward to seeing you. And so I've seen her just a few times now. Like, I think this last Monday was my third time working with her. But every time I treat, it's like she feels it in the knee and it's releasing, but it's guiding me again up the body and into other areas. And it's so fun. Even that long of a time has gone on since her birth, or since the birth. So
Isn't that amazing that the body
yeah,
holds on to it for so long? In fact, I think that's even more the reason why it's my hope and dream that we get enough certified birth healing specialists, that every mom who has a birth can get help and get the support and get themselves out of that birthing pattern.
yeah,
Because even, I think she probably wasn't having any issues with her open birthing pelvis until this knee pain. Who
yeah,
knows, right?
yeah. Wasn't. She said she wasn't, and she thought it was related to like a skiing accident, and it might have tweaked it, but
Right.
without having that flexibility through the pelvis, it kind of works together. But I spend most of my time helping bring balance back to her pelvis than I do working on her knee. And yet what I'm doing is helping her knee pain and getting her mobility back there so she can walk better and have better balance and all the things that she, wanted to work on. So it's pretty fun.
Yeah. Awesome. What's your favorite? You see all women of all stages and not just specifically pregnancy and postpartum. So what's your most favorite? What do you like to work with the most?
Right now, gosh, it's a toss up between pregnant because it's just so fun. I love the bellies and hearing moms' concerns. That's not just physical, but also that kind of a mental, emotional piece, and having some good answers for them. So I'm really loving that. And then honestly, like the postpartum, but I've been working some with breastfeeding moms, and like I said. Um, they're coming to me for that myofascial component, but yet I'm using a lot of your techniques with them because I'm finding that that birth trauma is a lot of what's causing those breastfeeding issues and or previous things that they're struggling with up and through here. So I know that's a little bit of a tangent, but it has kind
Yeah.
of been fun.
Have you had a pregnant mama that came in for pelvic pain and able to get them out in one session, get rid of the pelvic pain in one session?
Yeah, so I had one, she was, I saw her, she was out of state, and she said it helped, immediately, like within hours, she had texted me and said, yes, this has definitely helped my sacral pain, my low back pain. Unfortunately, with her, I wasn't able to continue on. So as her body shifted and changed, yes. And with the other moms that I've been treating recently, I would say it's helping, but again, as they continue to grow, it's like it doesn't take care of it 100%, but it's making moms
Right.
certainly more comfortable, and it's they're leaving even after they get up off the table. They're saying, "Wow, I can really feel the difference." So I know it works. It's just as their body's just changing constantly. So.
Yeah. Yeah. What would you say has been the greatest benefit of becoming certified as a birth healing specialist for you?
Oh, besides the fun I'm having, I mean, I would say that like it's so fun. I mean, I love coming to work, and what's
Yeah.
going to happen today, even the people that I'm seeing, I see this person today and I get to see them next week or whatever we decide on frequency, but the sessions are never the same. You're never walking in, it's the same person, but their body has shifted since the last session, something else. And so it's so fun. So,
Were you having as much fun before you got certified?
okay. Yeah, I guess I'll say I was having fun before, but didn't really feel that confidence with working with pregnant and postpartum moms as much. But my business, I would say, is really taken off. I'm a lot busier than I used to be, and I think a big part of that is moms are talking to each other, and they're, hey, you're having that issue. You need to see Justine. She can help you. So that's been fun to see my business grow, and for me to be able to share the passion on helping people get better.
Yeah, that's what when you're effective and moms start talking and they tell
Yeah,
people and then it spreads like wildfire. So you're not the first certified birth healing specialist to say that, it's everybody's practices are getting busier because of the effectiveness of this body of work. So yay, I'm
yeah,
so excited to hear that.
yeah, yeah.
Awesome. So what would you want to say to anybody, any of the practitioners out there that are considering the coursework or becoming certified? Like what would you say the difference between just taking the coursework and then becoming certified?
So what I really like, hopefully this answers this, what I really liked when I was looking at your program, for one, you speak my language, Lynn. So I knew even after, like, I don't know, like, like you have some YouTube videos, hearing you speak your language, it was my language too. And I was like, gosh, I need to, so if anybody is out there and has seen your stuff and it just seems right, go for it, because I don't know that this kind of work is for every single practitioner, right?
Absolutely.
It's a certain person that's going to be attracted to your line of work. So if you speak Lynn's language, get in her courses because you will not regret that. And then, darn it, I lost my train of thought. Ask your question again. I'm sorry, so sorry.
The difference between coming to the courses versus getting
Oh,
certified.
Yeah, so the other part of that was that I really like about your course and the certification itself is that the community that you provide. In your group, I know you're tagging your other practitioners, but you're really helping me to get the word out and to help me be successful in my business. And that's part of why I've grown as well, is that support that you provide and distinguishing between who's taking your courses and who is certified. And just like doing something like this Facebook Live, I really do appreciate you taking your time out to do the interview. And sit down with me. The directory is, one thing that I really, really like, that you're not charging for your directory. And I just really appreciate that. And being able to take the coursework, again, to repeat the coursework when I want. That was another big piece for me that I thought, okay, as I get into here more, if I want to repeat it and review things, or maybe get some more of my own treatment, I'm going to be honest, like that was a big part of doing our own healing work while we were in the classes. That's super important to me so that I can continue to be where I need to be a good practitioner.
Absolutely. That's what I tout the most, I think, is that that advanced course is really designed for you, the practitioner, to clear your blocks, like get your energy in alignment with you so that you can be more successful. Again, everything that I do, everything that I have designed for the Institute for Birth Healing is really about getting moms the help that they need. And that's my end goal. And teaching this information to other practitioners is one step of it, but making sure that those practitioners are as successful as possible in applying this work for moms so that moms can get the healing that they need really comes down to taking care of the practitioner and making sure the practitioner has released whatever blocks or limiting beliefs that they have that are limiting them from reaching more moms. So it really is.
And as soon as you clear that and you get to that layer, there's going to be another one. Are you willing to clear that? But every time you do, I find then I'm able to identify, because at some point someone walks into my office with something that I've, not all the time, but a lot of times with something that I can identify, and this is what we're going to do with it, and this is how we're going to help you. So
yeah. And the same thing happened to me. Once I cleared my own blocks, I would have 3 or 4 moms that would come in with the same issue that I just cleared so that I can help them, and it's how it works. And so I just really encourage, and I really want to help support the practitioners who are taking my courses, and especially those that are wanting to become certified. I want to support you in being successful. Because the more you are successful, the more moms you're reaching, which really helps me with my end vision goal of this Institute for Birth Healing. So that's so fun, Justine. Thank you so much for taking the time. And everybody, please, Justine has amazing hands. She's got an intuitive side to her that is spot on. And I really hope that any mom in that Colorado Springs area or surrounding areas, please go see Justine in the I want to say Woodland. I want to say Woodlawn because I'm going there in New Jersey. So sorry about that. Fair Lawn, New Jersey. But yes, please check out Justine, and we will put her link below. I really want to thank you for taking this work out into the world and doing it so beautifully and helping so many moms, as many moms as you do. And thank you. And I think we talked about it at the advanced course, but I can definitely see you on the teacher track someday as we grow this work and expand it more.
Yeah,
I would be honored.
Me too. So I continue to just do the work, and maybe someday that will happen. So thanks for me and meeting with me as well.
Yes, you're welcome. My pleasure. All right, everybody, we're going to go ahead and say goodbye. And please reach out to Justine and go see her, mamas. All right. Take care, everybody. Bye
All right.
bye.